Please welcome our Honorable Nagahaga, Governor Lou Leon Guerrero. Half a day. As of last night, we have 3 additional cases of COVID-19. This brings our total to 128 cases with 41 recoveries, 8 additional recoveries since yesterday, and 4 deaths. While this number gives us little hope that our measures have prevented the worst case scenario, I must stress that we are not out of the woods just yet. You may look at our numbers and become complacent. That is the biggest mistake we can make right now. The moment someone decides that our measures are no longer necessary is the moment we lose to COVID-19. The 1918 Spanish flu came in the 3 waves, and it was the second wave that proved to be the most fatal. Countries like Singapore, who were able to mitigate their first wave of COVID-19 cases, are seeing their infection numbers increase once again. And they began implementing even stricter measures. To be clear, we have not ridden out our first wave of infection, but we do have a small window of opportunity to prevent future waves, and it requires us to remain vigilant and stay the course. This is why I have signed Executive Order 2020-10. Under this new executive order, closures of non-essential government services, businesses and facilities, public and private schools, and public parks and beaches, except for individual use, will be extended to May 5th. This supports my extension of Guam's public health emergency by a previous executive order. But more needs to be done. Through Executive Order 2020-10 and under my public health authority as governor, my administration will execute a road closure traffic flow plan beginning tomorrow, April 11th at 10 o'clock a.m. Under this plan, there will be 4 road closures, and they are by Lucky Supply in Derido, Old Shen's Furniture in East Ganya, Calvary Chapel in Asen, and Shell Gas Station in Zarigona, to ensure that designated public roads are reserved for access only by those individuals who are participating in essential functions and activities. To support this plan, I have authorized the Adjutant General to issue active duty offers for the mobilization of National Guard personnel and equipment. Make no mistake, we are in a life and death battle for the health of Guam and everyone who calls Guam home. Those who follow social distancing rules, those who stay home except for essential businesses, help us to win this fight. Those who ignore social distancing pose a clear public health danger to themselves and those around them. In simple terms, their failure to exercise personal responsibility becomes a weapon against us all. If you are traveling for essential business, say so when you are stopped and continue with your day. If you are not, personnel will take the time to educate you about staying home and why it's needed to save lives. A little later, I'm going to ask Department of Public Works Deputy Director Jesse Garcia to walk you through the locations of each road closure in detail. But you should hear this from me. For the first time in our history, our love for family, the need we all feel to come together on special occasions and be close is a danger to ourselves and others. We are taking this temporary step as a public health necessity. We don't make these decisions easily or without thought. We are doing it to stop the spread and save our lives. More than ever before, we need unity, hope, and the political will to see this crisis through. I've told you before that this crisis would require me to make tough decisions. And while I will not shrink from that duty, I do not take any of these decisions lightly. We live in a free society. Each of us has fundamental rights, but all rights are accompanied by the responsibilities we have to each other. No new laws, no extraordinary use of the laws we already have would be required if we just stayed home. I'd like to bring up Linda DeNorsi now and to give you an update on our coronavirus status.
Thank you, Governor. Yesterday, we conducted a total of 37 tests, and of these tests, 30 are negative, 3 were positive, 3 were follow-up, and 1 was rerun. The testing as of March 12, 2020 to April 9, 2020 are a grand total of 697 tests. And of this number, 583 are negative, 114 are positive. I want to emphasize that the 114 are local. We also added another 11 from the U.S. Naval Hospital, and that testing was done through their DoD reference lab in San Diego. Plus, we have now 3 confirmed cases by DLS. This was a commercial laboratory that we recruited, so we had 2 more positive tests as of yesterday, and 2 clinically diagnosed local cases of COVID. Thus, our grand total is now up to 130 COVID cases. And in addition to that, I just want to emphasize that all these cases are being conducted through the grand total being through our Guam Public Health Lab, DoD, DLS, and 2 clinically diagnosed. And that's why we have the 130 cases as of today. In regards to the demographic distribution of our COVID cases, we have 66 residing in the north, 41 at central, 19 at the southern, 2 are homeless, and 2 are pending determination. That gives us a total again of 130. In regards to the age breakdown, we have the age group of 0 to 9, 1, which was a 1-year-old baby, household contact. The age group of 10 to 19 years of age, 7. And of that 7, 5 is due to a household contact. 1 was travel related to Honolulu, and 1 was through a birthday gathering at the hotel. From the age group 20 to 29 years of age, we have 12 individuals that are COVID positive. The age group 30 to 39 years of age, 13. Age group 40 to 49 years of age, 23. 50 to 59 years of age, 25. 60 to 69 years of age, 34. 70 to 79 years of age, 9. 80 to 89 years of age, 5, 90 and above, 1, and thus 130 total. In regards to the gender, majority are females at 69 COVID cases versus male 61 cases. The medical status of our COVID patients, 72 are stable, 13, however, are hospitalized, and of those hospitalized, 5 are at the inpatient care facility, 1 is at the ICU unit, and 7 is at SMU. 41 have recovered, 8 more as we speak today. 4 have died, unfortunately, and so we have a grand total of 130. The location of all our patients as we speak today, 43 are in home isolation, 29 are in the isolation of the Government of Guam facility, 7, as I mentioned earlier, are at SNU, 5 are inpatient of GMH, and 1 is at ICU. 41 have recovered, as I mentioned, and 4 have died. In regards to those that have traveled with a travel history, 18 have a travel history, and of the 17 individuals that travel, 3 of them travel to multiple countries, majority 65% traveling to the Philippines. 112 have no travel history, and of those that have no travel history, we realize that there are 31 with household contacts, 12 with community contacts, 19 with healthcare contacts, and that is further broken down, 5 as patient, 14 as a healthcare worker, and 50 have no reported cases at all of any contacts. Currently in our quarantine facility, we have 171 still under quarantine at our Government of Guam facility. Those, however, that have completed the 14-day quarantine, the grand total is 233. We added 2 more today that is under quarantine. Thus, That's why we now have 233. In regards to those that are fully recovered, as I mentioned earlier, and the governor did as well, 41 have fully recovered, and their age breakdown are as follows: 0 to 19 years of age, 0; 20 to 29 years of age, 4; 30 to 39 years of age, 7; 40 to 49 years of age, 9; 50 to 59 years of age, 7; 60 to 69 years, 8; 70 to 79, 3; 80 to 89 years of age, 2; 90 years and above, 1. In regards to the sex, majority again are female, 22, male, 19. In regards to the location, 11 that fully recovered are at the northern, 20 reside in the central region of the island, and 10 reside in the southern end of the island. 8 are travel related, and 23 have no travel history at all, and 10 is yet to be determined. Thank you.
Thank you, Linda. I'd like to bring up Deputy Director of the Department of Public Works, Jesse Garcia, to go over the road closure details.
Thank you, Governor. For the road closure, traffic closure plan, Route 1 Dededo, Lucky Supply; Route 1 Isagana by former Shen's Furniture; Route 1 Asan, Calvary Chapel; Route 8 Vergara by Shell Gas Station. The roads that will be traveling on would be merged into one lane on both directions for control of traffic and information, educational information for the National Guard to provide the traveling public. What's happening here is we're trying to control the movement of people, to control the disease that we're dealing with.
Okay. Thanks, Jesse. Open up for questions now.
Maureen Maratita, United Citizens Journal.
Buenas, Governor.
Buenas, Maureen.
So if we're going to have one lane either way, how many cars will be checked at any one time? Because this is going to cause potentially slowing of traffic.
I understand each of the cars, but Jesse may give you more detail.
Thank you.
Basically, out on the road, you should only be out there if you're essential. If it's not for essential traffic, you shouldn't be out on the road. You should be staying home.
I think we understand that, sir.
Yes, so that's
I'm
the purpose
asking
of
about
this.
I'm asking about the how many cars at one time can you inspect?
Well, we're not inspecting cars. We're diverting the traffic to go into one lane for our National Guard members to give educational information and.
So how many? Do you have any information on how many at one time they can deal with?
It's going to be one at a time.
Okay.
So we have 10 cars. All of them will be stopped for educational purposes.
So you won't be asking them what their business is?
Well, that's part of the educational purpose. If you're not supposed to be out on the road, you're not going for essential needs, then they should educate them and tell them to go home to control this disease.
Thank you, Maureen.
One question.
Okay. Yes, Maureen.
So we've had a number of readers who are worried about adequate time to prepare for curfew and for these checks. So I have, as one question, two parts to that. So we have one gentleman who's asking, will you give them enough time to prepare their employees who have, for example, shifts? And the other part of it is, and I was asked to read this as given, have you any word from the legislature that on Monday, instead of taking care financially of government employees, who already have a salary if they will give you the authorities you are seeking. So the first part was about time for their employees, and the second part was if you have heard from the legislature.
Okay, so we are announcing the road closures to take effect tomorrow on a Saturday. And you know, it is Holy Week, so people probably aren't going to be traveling out there as much, Maureen. So tomorrow it'll be started at 10 o'clock. So we specifically wanted to do it over the weekend, so then people will start getting used to these road closures, and so that's, I think, the preparation time that we would be able to give to them. As far as curfews, you mentioned curfews. We have not yet had the legislative bill. I don't know if it's already been discussed on the floor, but I know there is legislation there about the curfew. And so, what were you saying about the money, the time for them to? What was that last one, Maureen?
Legislature as to whether they would be discussing that on Monday, and
Discussing the which part?
the authority that you're seeking for the curfew.
Oh, yes. I'm pretty sure they will be. It is on their agenda, but I'm not too sure whether it will be on Monday. I don't think they're going in this weekend. I'm not sure.
No, I don't believe so.
Yeah, I think they are. I know that it is on the agenda. I think that's Senator Amanda Shelton's bill.
It's number 3 on their list, as we
Okay,
understand it.
so they'll probably be able to discuss it then on Monday.
Thank you, Maureen. Oh yeah, to the point.
Hello? Sorry, can you hear me?
We can hear you.
Okay. Hi, Governor. How are you doing today?
I am good, Oya.
You've all kind of taken us for a little bit. I think I'm in a little bit of shock, but these are some strong measures you have in place, and it certainly goes back to what you've said. Actually, for the last, I would say, week or so, where you've talked about the current situation being public health and economic crisis. You've created an advisory group of doctors to provide guidance through, the medical portion of this crisis, and you have your fiscal team. And you've talked about Ricky Hernandez from EDA, who's working on the financial aspect. Particularly in light with these increased restrictions, I think the question that a lot of people have is, how long are these restrictions going to stay in place? Have you had a conversation with the doctors about, the possibility of lifting the public health emergency on May 5th? Or have you spoken with the fiscal team about how long our economy can survive under these conditions?
Yes, so we are going to continue with these restrictive measures. As I had said, up to May 5th. However, if I'm not seeing any results, it may continue on. And I know that some states are continuing it on. I know countries are continuing it on. And the reason for that is what I had just mentioned in my press release, that there are countries now that have slowly lifted these measures, and they're seeing an increase of this coronavirus. So there's discussion among the experts that this coronavirus could come in waves, and we are in the first wave. And there may be a second wave, there may be a third wave, but that, I think, is influenced, Oya, by how well we follow these restrictive measures and how well we can contain and even eliminate this virus, if it can be. It may be that it becomes an endemic virus And then, of course, if vaccinations come to play, then we'll be able to have vaccination as a preventive measure, sort of in the same line as chickenpox, measles, and so forth. So it is a very serious virus, and I don't want to lift anything till I am assured that our measures have been successful. And some places say, well, if you look at normalizing your hospital, if it's in a normal situation, or that if your last death is past 10 days, but those are just discussed measures. Those are not really official guidelines as to when you can lift those measures. I know that there is no one definite requirement as to say, hey, lift the measures. It's all guided by what the situation is in your area. Washington State, I know, is starting to relax a little bit, and they're watching it very closely. For me, if I'm going to do that, I want to be assured that it's not going to recontaminate again our community. How do I become assured with that? I would like if we didn't have any cases for a while. And that may be a difficult situation and event to have, but if we all work very closely and very well together, comply to these measures, um, we will win it. And this is why I agreed to do an executive order on this road closures, because you see during the day there's still a lot of traffic going on there, and this measure is going to be able to re-educate people, remind them again about the seriousness of this virus, and to really be very responsible. Go home if you don't need to be out there in the road. Only travel for essential business, to and from your essential work, to the grocery stores, to the gas station, to your medical clinic, to pick up your pharmaceutical needs, and also your home houseware needs. And so I think this measure is a community outreach educational measure, and to also remind people and say that we are monitoring your travels. We want you to stay home, because I'll tell you, there is possibility that even if we lift these measures, it could again reinfect our community.
Thank you,
So,
Mama.
so I just want to say these are very drastic measures, and we are one of the first in the territories and even in the United States to have these real drastic measures. Like mandating quarantine of people that are coming from the infected places, and that has really proven really successful. In fact, those mandated quarantine, we saw that there were people that became positive, and we identified those positive people. So just imagine if we didn't have the mandated quarantine, those people that were positive carrying the virus would be out there contaminating our community. Just an example of how well these measures are working.
Right. Thank you, ma'am.
Thanks, Leah.
To follow up on that, you've also talked about this kind of leads into the budget and the what's necessary in our community as far as operations to maintain health and safety.
Right.
You've said that non-essential government workers will continue to get paid, and that you've at this point, or at least when last asked, you said there were no plans for furloughs or reducing pay.
Right.
We're seeing more businesses shutting down. We're seeing more people losing their jobs or getting the hours at work cut down. How is your fiscal team tracking this revenue? And do you think you'll be able to sustain this current level of operations at this rate, and considering, the length of time we're looking at?
Right. So we are tracking the revenues very closely. I think we're like 6 months into the budget, 7 months into the budget. I'm looking at lapses of everybody's, and everybody, all the agencies, and looking at where to place those lapses. I'm also looking at the revenues that we had collected that was beyond what we had budgeted in the first quarter, and that's helping us. It's also helping us to be able to pay for our expenses in relation to the coronavirus. We are also, Oya, getting a lot of federal aid, a lot of federal aid. This pandemic unemployment program is going to really help a lot of our people in terms of being able to have some weekly financial assistance to help them go through this crisis, and that's for 39 weeks. And then, of course, we have the economic recovery program, which is the tax rebate that's going to have a shot in the arm for some of these individuals who really need it, and it's going to continue on through federal aid again. The businesses are able to borrow some money, and some of them are just outright grants if you continue employing your people. There's also a coronavirus relief fund, which has been given to all of the governments and to include the state and territories. And it's $150 billion tranche. And out of that, $3 billion are designated for our territories. And out of that $3 billion, we will be getting $112 million. And that's to help for the expenses and for the costs as a result of this coronavirus, and also to help with the economic impact of this coronavirus. So the federal government is going to be pouring in a lot of money, and you saw the CARES Act that was passed by the Congress and signed by the president. That's a $2 trillion federal assistance. They are going to have a fourth package, and they're looking at even increasing subsidies, increasing more aids to hospitals and the government. Additionally, they are also going to have a lot of infrastructure projects that they are going to be funding, which is a way to stimulate the economy and a way to get people back to working. So if I said that, can we do it with just our local monies? I would say no, we cannot. The fact that we are part of the United States, and the fact that, you know, they have held us in importance, and the fact that they have not really, the fact that they've included us in all of the federal programs is a great positive for our economy. So somebody asked me yesterday, how long would it take for the economy to recover? If you look at past crisis situations with the H1N1, the SARS and all that, it took us about close to 18 months to 24 months before we recovered in our tourism industry. But when we did recover, we recovered very, very well with increase in tourists. We have to also think about what's happening in the other Asian area, right? Because the tourists aren't coming. They're not traveling. They don't want to travel. They're also afraid of reinfection and recontamination. So this is the beginning, Oya. We're not even halfway, I don't think. It's scary, very scary, both for the community and also for our economy. Sorry, I had to just put that in because it is a fact in reality.
Yes, hi, Governor.
Hi, Steve.
Hi. So just going back to the National Guard checkpoints. So would you
It's
say
not a checkpoint, it's a road closure. It's very important that we don't say checkpoint because my legal authority is only roadblocks.
okay? So
Thank you, Steve.
Okay, so as to these road closures, would you say you're intentionally creating traffic jams to dissuade people from leaving home at all, even for essential trips?
No, I don't think that was my intention. My intention is to monitor people's travel and to again reinforce the importance of staying home. If the consequences is a travel backup and so forth, then that's the consequences. And so maybe then people won't travel unless they do have essential business and essential activities that they need to go to.
And also, are there any guidelines for these checkpoints? For example, should drivers be wearing masks? I'm sorry, roadblocks or road closures when should drivers be wearing masks when they're interacting with the guardsmen?
Yes. And we will also remind you that when you go into public places to please put your mask on. So it's hey sir, what I mean, I'm just thinking the scenario. Hey sir, what is your purpose on this road? Oh, I'm gonna go to a grocery store. I need to buy some groceries. Okay, sir, just continue on, please. Remember to wear a mask when you get into the grocery store, and please remember to go home right after you buy your groceries. And be sure to wash your hands, take off your shoes before you go into your house, disinfect your air, that kind of thing. Thank you, Steve. John O'Connor, post.
Hello, Governor.
Hi, John.
Good afternoon. Just to follow up on some of what you were saying regarding the recovery. Yesterday, you talked about you gave an update on the federal assistance program, and you also announced the cash advance payment program. Although the criteria for the cash advance payment would be people making 10K or less, this seems to exclude the majority of private sector workers. Now, you've asked people to, if they needed to, apply for public assistance. And we've been seeing a lot of the food distribution lines increase, and Salvation Army as well has been seeing increases in their food bank clients. What do you have to say for the majority of private sector workers who are suffering right now, who aren't going to be seeing any financial assistance as soon as some of the other workers?
All right, so several things. Everybody who has filed a tax return in 2018 will be eligible and will qualify based on their income. So again, I just want to repeat. So if you filed and your gross income is 75,000 and below, and you're an individual filer, you will be getting $1,200 in the mail. If you are a couple filing and your gross income is $150,000, then you will get $2,400. Every child in your household that is 17 years and below will get $500. This is eligible for all those that have filed their taxes. But like maybe, I think Daphne said there's about maybe 63,000 people that have filed their taxes in 2018. We are advancing this program for those who we feel is most needed. So there's the people that are in the lower economic income group. And when we looked at our analysis and what we could afford, we said, okay, we could afford those people who are making 10,000 and below. That's about 6,200 taxpayers. And with their children, it's about 3,200. So we will be able then to advance that amount based on what our local general fund can afford. And we can probably start it by the middle of next week. In the meantime, we are working very closely with IRS and the U.S. Treasury to meet all their requirements, which we have. We're just waiting for our implementation plan to be approved. And so once that's done, 2 weeks after the approval of the implementation plan, we will be able to start getting more of the money from the federal government so that then we can continue on giving those checks to the rest of the tax filers. So that portion is what's going to help. That's a one-time shot. We also have, I mentioned the federal pandemic, unemployment compensation program and the pandemic unemployment compensation program. And that's the one that would give people who have been unemployed as a result of the coronavirus or whose hours have been decreased as a result of the coronavirus, they will be getting a weekly check for the next 39 weeks. So again, there is those federal aid that's going to happen, and it's going to come within 2 to 3 weeks. In the meantime, I am also saying that there's public assistance and there is also food stamps, the SNAP program, which has been increased, and I increased the income eligibility so more people could be eligible for that program. The other thing that can happen too is employers can apply for the pay protection loan program, which would give them up to $2 million in funds if they have employed their people. They will be able to forgive that part of the loan that funds their payroll. So that's the outright grant.
Sorry,
So there is help. There is help out there, John. It's not that we're leaving our people all out there to, to suffer. There's help, and every state in the United States is rushing for these help because we're, like I said, we're not unique here. We are just as desperate to get the help as everyone else in the United States, and that's why the federal agencies that are responsible for this, they're rushing real quickly to provide the guidance and the advisories to how this program will be administered.
sorry. Just to clarify the question, I suppose I'm asking, what is your message to people as they wait in order to get some of the financial assistance that they're trying to get?
My message is that we are working very hard as an administration to get you the help. And my message is if you can also, call public welfare and public health to see how you can get some assistance till this help comes to being. Food stamps, of course, food is one of the biggest things. We are continuing with the grab and grub. We are continuing with the senior citizens, and so there is assistance there out there. So my message is we are getting you the help as fast as we can.
All right, thank you, Governor. And for the
Okay,
second
John.
question,
Sure.
I know we don't want to, I know we're calling it roadblocks, but it does kind of sound like a checkpoint from the description DPW gave.
It is not a checkpoint because checkpoints are you stop a person because there's reason to stop them in terms of like a crime that maybe could be happening. Like, checkpoints would be the DUI, speed traps. Those are considered checkpoints. I am not calling it checkpoints because I don't have legal authority to cite them. I don't have legal authority to penalize them. That's what I'm asking the legislature to provide for me. So instead of that, and because it's very urgent that we monitor and we restrict this as soon as we can, that's why I'm using the word roadblock.
Got muted. Oh, hello, Governor.
Yes.
Can you hear me? Right. So I suppose the question then would be, the legislature is working on providing you the authority you need to create those additional restrictions that you want, including the checkpoints. What then is going to be the curfew time? And do you have any details on what residents have to do once, what documentation they have to provide or signage that they have to post once you've established the checkpoints?
Okay, so the curfew, I guess by way of the legislative bill, is going to be at 10 o'clock. I think it's 10 p.m. to 6 a.m. And it's for all residents. And what was the other one about the checkpoints? You were saying the penalties for them? Okay, so their penalties, I have no input on the penalties. I did not suggest any penalties. That is their own, that's part of their legislative bill. But penalties are made so that there's some enforcement and there's some consequences of the behavior that you have done that's violated a statute. Thank you, John.
Good afternoon, Governor.
Hi, Nestor.
I just wanted to get to the roadblock, and I get it completely that you can't call it checkpoints, and therefore there's no sanctions. And at the risk of editorializing, I don't disagree with that. I just want to give you an opportunity to answer if you think that if people exercise more personal responsibility, we wouldn't need the roadblocks in the first place.
Absolutely, Nestor. You hit it right on the nail. But because they're not showing that, it's like, listen, if we don't have to do roadblocks, I would rather not do roadblocks. If everybody stayed home like they're supposed to do, they'll stay home. It's a matter of discipline. It's like disciplining your child, right? And so like you tell your child not to do something, the child still does it. So you put other measures to then educate your child that, hey, this behavior is not responsible. That's basically it.
Thank you, Governor. And the second question is, I'm sure you might have heard by now that there is unfortunately one sailor from the Theodore Roosevelt that is now in the ICU at the Naval Hospital. Given the fact that there are more than, I believe, 400 positive cases, does that cause any concern for you? Because that's, I guess, 4 times the number of civilian positives.
First of all, I just, I am praying for that sailor. I hope and of course wish the best for the sailor and the wife and family. It's unfortunate that has happened. As far as the positives, all the positives that have been identified with this Theodore Roosevelt sailors are all within the confines of the base. So they're all within the fence. And in fact, they are very closely monitored. They have regular checks from health professionals, just like we do with our isolation facilities and also our home isolation. They follow the same CDC guidelines that we do. And I'm very comfortable with our CDC guidelines, and I'm very comfortable with how our public health has been administering these CDC guidelines. I'm very comfortable with their surveillance. I'm very comfortable with their contact tracing. I'm telling you, for how serious this virus is, Nestor, I think we have done a good job in monitoring, tracing, testing, given all our limitations, planning, preparing. And I am also comfortable that the military is doing the same thing. In fact, they're bringing in more medical personnel. They're bringing in a whole hospital unit, and they're bringing in more supplies. And we have been working very closely with them to help each other. in making sure the resources are there given our limited resources. So even with the medicals resources, they will be able to help us in our community should we start getting more, and should we go in a trajectory that was mentioned, which we're not out of the woods. We haven't yet gone to the dates where there is the possibility of a search, but we're watching it very closely. So, so Nestor, I am, all the way up to the Department of Defense. They are aware about the USS Theodore Roosevelt. There's great attention to making sure things are being done well. There's great attention about going through the processes and the procedures and their protocol. So they're doing everything that they can do also to prevent their sailors to more exposure. Not only their sailors, their military personnel that live in the base. They're concerned about them too in terms of exposure. So yes, I'm comfortable with what they're doing.
Thank you, Andrew. Kevin Kerrigan, PNC.
Good afternoon, Governor.
Hey, Kevin.
On the road closures, just some points of clarification. Will these road closures be conducted every day? And if so, during what times? And is this,
Every day.
is this exclusively a National Guard operation, or will Guam Police be involved? And can you also talk a little bit about the legal authority that allows you to do this?
Okay. So it is going to be 10 a.m. to 10 p.m. every day, right, Jeff? Okay, every day. It is going to be manned by the National Guard, but there is also going to be backup of the police in case there's something that they need to provide in terms of law enforcement. But it's primarily going to be manned by the National Guard. And what was the third thing that you asked?
Legal authority. Can you talk about
legal authority? So we did run this by the AG, and the AG did offer the strategy of a roadblock, because that is within my legal authority. I've done it, like for example, for the Liberation Day parade and events like that. So he advises me that yes, I am within my legal authority.
And finally, if I can, do you still need the legislature to pass a bill giving you even more power to set up checkpoints? And if so, what more authority do you want?
Initially, I think we were discussing about citations, civil misdemeanors, civil penalties for not adhering and complying to the executive order. In terms of the curfew, it has to be legally mandated because the statute only addresses minors. So, I want to make sure, Kevin, that after all of this, that I don't get put in jail because I didn't follow legal mandates. So I am very cautious about that. I do have my legal advisors and also the Attorney General that is helping me through these decisions.
Thank you, Kevin. Adriana, see you again.
Hi. My first question's for public health.
Okay, Linda. Yes.
Hi, Linda. Hi. So public health announced that the 7 group settings for the COVID-19 positive cases. And, looking at these clusters, the most confirmed cases being 17 are from 2 healthcare setting locations. Can you identify these locations as you did with the other group settings? You said the church's name, the United Airlines, and others.
Yeah, right now I don't want to name them, but I can tell you the time period that first setting is and the date of when the healthcare setting had happen. Is that something that I really prefer not to? Again, as the governor indicated, I'm very careful with releasing information.
Is there a reason why you can't name them?
It's because, again, these are private businesses, and I just want to make certain that the anonymity is ensured for that particular case.
Okay, so what further details can you give us in regards to those two locations?
Okay, the first setting, I can give you the fact that there were 5 positive cases, and because of that situation, that particular healthcare setting did close, and they closed, and that the time period was before the March 28th, 2020. And then the second area is 12 positive cases. That's the best I can give you at this point in time.
Okay, all right. My next question is for the local government about addressing homeless population.
Oh, homeless population. Yes, who's this, Adriana?
Adriana.
Oh, Adriana, sorry.
Yes, hi, Governor. So,
Hi.
yeah, hi. So my question is how the local government plans to address the homeless population. Are there any efforts to open shelters? Where are we? You know, is there anything new in that movement?
Yes, there's been progress with the homeless shelters. We're just kind of refining the details, but I feel very comforted by the fact that we will be addressing the homeless shelter very soon.
How soon?
I would say maybe within there's some fixes that need to be done. So as soon as those fixes are done, we would be able to then, I would say maybe within the next week, 2 weeks.
Within the next 2 weeks?
Yeah.
Okay, so can you provide any other details on these shelters?
No, only that we are, you know, only to say that I am very concerned about the homeless shelter. And I know that guidance has been given that it's very difficult at times to bring the homeless in because, you know, of their, either they don't want to go. We have to make sure we're not violating their civil rights too, and so forth. And so the guidance is, if they don't come to you, we need to bring the resources to them. So that's been what we were looking at. And I think the place that we've identified, and I don't want to say it right now because I want to make sure it's final, that it's actually going to be in an area where they're mostly, where they are mostly roaming around. Thank you, everyone. Now for closing to the governor. Yes. Thank you again for this opportunity. And, you know, every day I will say the same thing. Stay home. If you have to go to do an essential business, please do so. But now be reminded that there will be roadblocks that would be monitoring your travels and to be able to provide you with the education. I cannot overemphasize the seriousness of this virus. You know, it can quickly turn a person around in a bad situation. And so again, I am very worried and I am very concerned about the safety and the lives of our people. And I would like to continue these very restrictive measures till we feel that we can at least have some, maybe a slow evolution of relaxing these measures. Again, I am very sensitive to the needs of our people that are unemployed, whose finances and income is no longer there as a result of the coronavirus. And our administration is working very aggressively to provide the help that we can in a more expedient way. So again, I just ask for your understanding and your patience, and we will get through this. Thank you, and remember to stay home.